The Integrated Behavioral Health Program began in 2015 and was supported through a grant from the Minnesota Department of Health, Office of Rural Health and Primary Care. The purpose of the program was to help rural critical access hospitals to successfully coordinate behavioral health services organizationally and operationally. The top roadblock identified was the societal stigma of mental illness. In 2017, the IBH Stigma Project was created, and RHI began working with 6 hospitals from Wilderness Health ACO. Hospitals developed a regional vision to create healthy communities where there is no stigma of mental illness, and worked with community partners to implement initiatives to eliminate stigma.
Starting the Stigma Project, I was extremely impressed with the amount of people within our community that wanted to be a part of it. So right there, that's telling me this is needed. The room was full of every organization you can think of, from the police department to the schools to our Native community to, everyone sees that this is a problem and we need to work together. It warmed my heart to think that that many people in this community wanted to reach out and help.
You know, we in northern Minnesota, we take care of our communities. If you have a cancer, if you have a broken leg, your refrigerator is jam-packed full of all kinds of food, your lawn is mowed, your kids are cared for. But if you go into a 28-day program, nobody knows what to do. They don't know what to say. They don't know how to help, and they don't show up. If we can talk to each other, if we can say it's okay that you're having a crisis, and if I know what to do, and we need to make it okay to come forward and say, I'm in trouble. Can you come sit with me?
When I was introduced to the Stigma Project regarding mental health illness, I thought, what better thing to do than to bring that to our ED? Unfortunately, a lot of people get stigmatized because of their mental illness. It has touched my life in many ways, and I know it's touched millions of people out there. So it's time to stop shutting these people down. It's time to stop that stigma. It's time for all of us to open up and truly listen to them and figure out what their need is. And what I was seeing as a nurse and as a health supervisor and now as the director of emergency room is people just think, let's just do what we can for them and on their way. They rather just see them come in and get out as fast as we can because we don't know how to deal with them.
Prior to our first community gathering, I attended a regional gathering down in Duluth with other partners, and there we kind of identified the regional objectives. Each participant was able to then start to work towards those initiatives in a way that made sense for their local community.
Community Memorial Hospital is the hub of our community. We are serving the schools, we are intertwined with Carleton County Health Services, and we do have the ability to bring a group together. So our goal with this project, the Stigma Project, is to make sure we're pulling from every possible resource we have and bringing all of the key players to the table so we can come together and make a plan to help serve our community.
So we decided to utilize Make It Okay not only just within our staff, but we also wanted to reach out to the broader community. My goal in presenting, utilizing the Make It Okay campaign materials is to first of all educate on what is mental illness. Our culture has made it such a taboo subject that people are even just afraid to ask, what is this? What does it mean to be bipolar? What does it look like if someone has an anxiety disorder? How does that relate in everyday life? They just don't know the answers to those questions. And then from that, it allows us to look at stigma. Those are my 2 goals when I present, is first to educate on what mental illness is, and also what is stigma, how do we address it, and to give some tools for individuals in reducing that stigma within our community.
How can we launch this Make It Okay? We had a few issues we wanted to address before we did our formal launch. We wanted to bring in someone from the Make It Okay organization to do what's called ambassador training. So they come on site and they'll train individuals on how to become more comfortable in talking about the Make It Okay campaign. We created a mission and a vision around our own Make It Okay campaign. We had posters made that had that mission and vision on it. We had ambassadors at our information table. We had a float in the parade, all decorated with Make It Okay information. Our next push was presenting Sam Miltich here at the Edge Center Theater. Sam is a really talented young jazz musician out of Grand Rapids, Minnesota, and he does a piece called The Improvised Life, where he talks about his own experience battling mental illness as a working musician.
The arts and music in particular is a way to speak directly to people's hearts, to raise awareness and to educate people. When people see artists performing and talking about their own experience, it can be a very awakening thing.
One of my encouragements is, as not just a pastor, not just as a mayor, as a community member, we need to come together, and if somebody's struggling with an issue and we see it, we need to be willing to open up the conversation about it and to call it what it is, because until we call it what it is, you can't get help for it. On the makeitokay.org website, they have a proclamation for cities to adopt a Make It Okay Day. We did that. It is going to be on the Friday of Mental Health Awareness Week in October. And so as we look forward to that, we're going to be trying to incorporate the students in the schools, Paint the City Green Day. We wear green to raise awareness for mental health awareness. Because if we're just inside our own walls, it doesn't impact our community. We need to be reaching out.
It's just been amazing that we have so many people come together and work on one project, opening everybody's eyes to mental health and the stigma that goes with that. So I mean, it was a really great project.
Patients with mental illness, patients of addiction, they don't understand. You know, I think a lot of people feel small community, it doesn't happen here. But it happens everywhere. It happens all over the country. It doesn't matter where you live. It's there, and that's why we need to address it.
By raising awareness, we hope not just suicide, but all mental health, that people are aware that we are trying to talk about it and that we are providing resources to help them get the assistance they need.
My first piece of advice is to really sit down and think about who are the individuals in your community that are going to be willing to share their thoughts and ideas, hopefully to share their time with you as you're starting to launch some ideas.
In a small town, we know everybody. And to hear people who are your friends, your neighbors, you know, your coworker, somebody that might have kids the same age as yours in school, stand up and share their story and struggle with mental health and how a supportive community or different things have made the difference in their journey in recovery is huge.